Hello everyone, I am Dr. Swetha. I am a consultant prosthodontist at Two Dogs Kondapur. Today we'll discuss a little bit about root canal treatment and why it is done. So your teeth is made up of three main layers like enamel, dentine and pulp. When there's a small cavity that you identify in the enamel of the teeth, usually you don't have any symptoms. They are usually small cavities that you identify only with the help of a tongue. When you run your tongue in the mouth and then you find a small hole in the tooth, that is usually your enamel cavities which do not cause any pain or discomfort. So usually what happens is from this area onwards, when there is an active phase of cavity going on, cavity spreads from enamel to the second layer of the tooth, which is the dentine. So when this spread happens, usually patients come to us with small symptoms like sensitivity to cold or sensitivity to cold food, cold water, and that goes away and comes on and off only in seasons like rainy season and winter season. And if it is ignored at this phase, and again when there's an active phase of cavity happening, the cavity spreads to the third layer of the tooth or the center of the tooth, which is the pulp. Pulp is basically the nerve supply of the tooth. Every tooth in your mouth individually has a nerve supply, giving all the nutrients to the particular tooth. So when then from dentine the cavity spreads into the pulp, usually patients come to us presenting with pain and discomfort that arises at lying down, that arises while sleeping, or they wake up in the middle of the night with a lot of pain and discomfort. Sometimes you also have pus discharge coming out of your gums, or you notice a small pimple on the gums, which comes on and off and then goes away. But this is a situation which requires some amount of attention. In fact, even an enamel cavity has to be treated immediately so that you can avoid any larger procedures. So when the cavity reaches the pulp and then so many presenting symptoms are there, the only advisable treatment to prevent the removal of teeth or to prevent the loss of teeth is to do a root canal procedure. So now what exactly is done in a root canal procedure is, because there is a spread of cavity from the enamel to the third layer of the teeth, first we clean all of that area, we anesthetize the patient, clean all of that area, and then once we reach the pulpal portion or the nerve portion of the teeth, we clean it, we remove it, and then clean the entire canals of the teeth and the root portion which is inside the bone. Once that is done, all the empty spaces are filled with a rubber-like material and the entire tooth is restored with the help of a filling material. So what are the things that we achieve out of a root canal treatment is, one, you definitely lose all of your symptoms of pain, discomfort, swelling or any infection that you have. You are preserving the tooth from being removed so that it can stay in your mouth for at least 15 or 20 years more. Another important thing is that you're preserving the integrity of the tooth. Also, if it is a front tooth, you're preserving the aesthetics. If it is a backside tooth, you're helping with the function, like chewing efficiency and everything is not compromised because of getting the procedure done. What happens if you don't get the root canal done? There are a lot of patients who are not convinced to get this procedure done, either because they are scared or because they are not convinced that they have a particular problem, or want to ignore it with use of antibiotics and painkillers. So one thing is, any cavity that happens in a tooth is an irreversible problem that you have. So once a hole on a tooth is formed, it cannot fill itself or it cannot repair itself. Enamel also cannot repair itself. So root canal is the only procedure to be done. Suppose you don't want to get the procedure done, you have missed out getting a filling done when it is in the enamel, and then it spread to the dentine. Even then you have not got the filling done. First the infection spreads into the pulp of the tooth, which causes all the symptoms that I've already mentioned. If you have not gotten the root canal done, even then it spreads into the local area around the roots of the teeth in the bone. It starts spreading. From there it goes into the adjacent teeth as well, because your bone is like a small sponge which has holes. Like how a sponge has holes, even your bone has holes inside. So the infection is mainly your bacteria growing inside, right? So the infection spreads into the adjacent areas of the bone, also sometimes involves the teeth that are present on either side of the affected tooth. That makes it a one tooth root canal to a multiple tooth root canal or other issues too. Even at that point, if you have not gotten it done, the infection can spread into the underlying bone more and also can go into the muscle spaces from there, making it a life-threatening problem to have. So something that could have been a small filling has now become a much more difficult problem to solve. So root canal is not a scary procedure. It actually helps you with all of your discomfort and pain that you have, and it will also make sure that you do not lose your teeth. You can also keep the teeth in the mouth. So instead of losing the tooth, having multiple infections, it is always better to get the procedure done. Most patients are like, now you asked us to get the root canal treatment done, and now you're saying we need a cap. So why do you really need a cap or a crown over a root canal treated teeth? What happens is, now that there was a cavity, you have irreversibly lost some amount of normal tooth structure that was supposed to be there. So which goes deeper and deeper, and making, first of all, making the tooth brittle. Usually the most ideal time to get a cap done after a root canal procedure is about 12 to 15 days. The reason being, like our body, our tooth is also made up of water. So because the whole point of root canal is to make the tooth non-vital so that you don't feel any pain or discomfort. Because it has become a non-vital structure, it starts to lose out on water very soon. The maximum amount of water loss occurs in the 12 to 15 days after a root canal procedure is done. So now if you delay it more and more, or the whole purpose of root canal, that is to save the teeth, is lost. You lose more and more tooth structure, which eventually ends up in removal. So to reinforce the structure, to make sure that your aesthetics is restored and your function is restored, it is always better to have a crown on the root canal treated teeth. For any queries, you can reach us at Tooth Docs Kondapur, or drop a comment in the post. Thank you.